Scott McConnell here from Distance CME. I wanted to change up the video format just a little bit this week and talk a little bit about how to recertify with the National Registry. Now, I actually get a lot of questions from people. Listen, my company usually does it for me. I'm a new EMT. I'm not really sure how to do the paperwork. The National Registry's website's a little confusing. Can you help me out? So I decided to make this video. Today, Tuesday, we're going to start off with the EMT basic recertification through the National Registry. And then on Thursday, we'll talk about the AEMT and the paramedic recertification through the National Registry. First, I just want to say, don't forget you have to transition. Now, by transition, I mean the National Registry has adopted the new core course requirements. And as such, you have to take a course that meets certain criteria to bring you up to the new level of education. So if your National Registry EMT Basic expired March 31st of 2011, I'm sorry, it's already too late. March 31st, 2015 was your deadline. Now, if the last time your basic expired was March 31st, 2012, then you only have until March 31st, 2016, which would have been 2 recert periods from your last recertification. So if you have not taken a course that has transitioned you from the old NREMT-B to the new NREMT, please do so. So let's talk a little bit about what you need to recertify National Registry. First, I want to say there are 3 ways to recertify. The first way, you go every 2 years and take the test. Okay. The last time I checked, a lot of people do that. A lot of people don't do that. Some people like it, some people don't. I personally don't want to take that test ever again. The second way that you can recertify your National Registry, you can cobble together multiple courses to garner the total of 72 hours that you need. Now, things like AMLS, EPC, ITLS, PHTLS, all great courses. You would then have to break down those courses into the individual course requirements to make sure that you meet hour for hour the requirements from National Registry. Or the last way. The last way I feel is a lot simpler. First, a 24-hour refresher. So a 24-hour refresher covers 1 hour of preparatory, 2 hours of airway, 2 hours of OB infants and children, 3 hours of patient assessment, 4 hours of medical behavioral emergencies, 4 hours of trauma, and 8 hours elective. Now, the preparatory category, things like quality improvement, well-being of the EMT, scene safety, medical legal, airway, basic airway management, oxygen delivery systems, techniques, oxygen therapy, adjuncts, OB and infants, obstetrical emergencies, gynecological emergencies, trauma emergencies and care in the pediatric patient, patient assessment, things like scene size up, assessment of the medical patient, trauma assessment, communications, documentation, medical behavior, chest pain, acute abdominal, emergencies, respiratory emergencies, environmental emergencies, trauma, management of shock, bleeding wounds, soft tissue injuries, and then the elective. The elective can pretty much be anything that you would like it to be, anything that interests you. So once you get those 24 hours out of the way with the refresher, then you need 48 hours more. Now, that 48 hours more can be anything you'd like. Advanced burn life support, PHTLS, PALS, PEP, AMLS, ACLS, it doesn't matter. It can be anything you'd like it to be. Now, there's a couple of small caveats to that. First, a maximum of 24 hours can be applied from any one topic area. So if you take, let's just say, AMLS twice, you can't count both of those courses. Hour for hour can be applied from those standardized courses, AMLS, ITLS, PHTLS. You can get a maximum of 12 hours through things like teaching CPR, emergency driving courses, and dispatch training. Okay? And of course, college credits, they count as well. 1 college credit equals 8 hours of continuing education, but cannot to exceed 24 hours per topic. Right? And of course, it has to be something related. You can't take, the physiology of basketball and have that count. A maximum, and this is really important, A lot of people get this confused. A maximum of 24 hours can be applied from distributive education online. So what does distributive education mean? Well, distributive education are things that are non-interactive. So this video, as an example, if you had a question about something that I'm saying, there's no interaction here. So this would be distributive education. Now, of course, you couldn't count this video, but anything where there is not a live instructor is distributive education. So things like magazine articles, narrated PowerPoints, there's a bunch of services out there that do distributive education. A maximum of 24 hours can be applied to your 48 other. Now, in your 24-hour refresher, a 24-hour refresher, a maximum of 10 hours can be applied from distributive education. So in essence, you can do a maximum of 34 hours of distributive education from your 72 hours total. Okay? Or you could come to us, Distance CME. All of our courses are live, interactive, and are not distributive education. So feel free to take the test every 2 years. Okay, try to cobble together the amount of hours that you need, and make sure, of course, that you get the total amount of hours in each category that you need. Or, super simple, come to us, www.distancecme.com. Our 24-hour EMT refresher is also a transition course for those who need it. So, once again, Scott McConnell from Distance CME, and I'll put the website, the address of the EMT brochure that you can get all this information on from the National Registry website right after this video. So, Scott McConnell from Distance CME saying, hey, thank you, and look forward to doing another video. Thanks.